Okay, hi, this is Christine, your feeding specialist, and I am going to go through what to put on your baby's registry and what not to from the perspective of a pediatric feeding therapist. We want babies' oral motor skills to be, progressing in the right direction. We want them to have, the best possible chance when they are starting to eat, that their muscles are doing what they're supposed to do, and oral motor skills really do start from birth or really even pre-birth. They do start swallowing and suckling and sucking in the womb. So when they get out, they now have this other option, which is the pacifier. Now, I'm not going to say that the pacifier is bad. I'm not going to say don't use it. I definitely used it for my son. It is on my current baby registry right now, but I'm going to tell you what to put on and what to avoid and why and when you should be getting rid of the pacifiers. Okay. So first, let's start, of course, with the let's not use these. And I know these are super, super popular. In fact, before I really got into pediatric feeding, I registered for this exact same toy. Everybody had it on their registry. It's just the cute thing that you just have to have, right? But these actually are not great because what it does is the weight of the animal pulls down on baby as they're suckling, and it actually, it's not great. So the pacifier itself is actually pretty good, but the weight of the animal is the issue. So keep the animals and the pacifiers separate, please. Instead, I would recommend, obviously, doing something that is without, just the pacifier, the plain, the Avent Soothie. This is the shape that you want to look for, okay? It's called a cylindrical shape. Completely ignore anything that says orthodontic. It's complete marketing. It has nothing to do with proper oral motor development because there are lots of different pacifiers that claim to be orthodontic and they do nothing to help babies' teeth. Okay. So anyways, I want you to just focus on the shape of the nipple. So shapes like this are the most ideal because what will happen is we want them to basically cup the nipple. And what that looks like is their tongue is basically going to form like a little groove around the nipple. And when it's that cylindrical shape, it allows them to do that much better. And that is the correct tongue posture that we really want baby to have. Okay. So that's what happens when you have that cylindrical shape. You have this exact cupping motion here where the sides of the tongue kind of hug the sides of the pacifier and they can suck. Okay, so that's a good one. Even something like this, the Dr. Brown's is good. It has that same kind of shape. It's a little bit more tapered, the nipple size, but it's the same idea that the tongue is going to hug the sides of the pacifier. So something like this is better, than I'll show you. Ideally, something like this shape. So there's nothing. Now, this is probably one of the most popular pacifiers. And in fact, this is the only pacifier my son used. But it's because that he actually couldn't do this cupping motion. It was much harder for him to do this motion. So when you have this flatter pacifier, like the MAM pacifier, basically the tongue doesn't have to do any work. Okay, so that pacifier is flat. It keeps the tongue flat. It's actually easier for babies to use this type of pacifier. However, that doesn't mean that it's good oral motor wise, right? So ignore developed with medical experts. That means nothing. Wasn't developed with oral motor or feeding experts, that's for sure. But again, kids that are going to, or that might be struggling with feeding, you might notice that they gravitate towards this pacifier more than this other cylindrical shape. And that's usually because there's a skill deficit there. So I'm not saying never use this because when baby is hysterical crying and this is what is soothing them, I totally get wanting to put this in their mouth. So I'm not saying not to do that. You might want to have this as like that backup, but I just want you to be aware of the difference and try to gently encourage them, maybe when they're not upset, to practice with this other pacifier, if that's the route you want to go. Now, some kids will actually just not like any pacifiers. And I mean, that's fine. You certainly do not need to take a pacifier. What you want to do is around 6 months of age, start only giving them the pacifier to soothe at nighttime or at nap time, right? So when they're going down to sleep, if they need that passy, give it to them then, but try to, during the waking hours of the day when they're not sleeping, I would try to avoid it, because we want to start weaning them off so that at 12 months, they're not needing it for daytime or nighttime use. After 12 months, it definitely becomes immeasurably more difficult to take this pacifier away. They become more cognitively aware, they become more attached, they become more dependent on the pacifier to do things like fall asleep or to soothe or cope. So it's more ideal if you can start to wean them starting from 6 months to just nighttime, and then by the time they reach 1 year of age, we should be getting rid of all of the pacifiers completely. And that is the general guideline for proper oral motor development and skill. Okay, so hopefully this was helpful to you. So my baby registry is, we are definitely putting these types of pacifiers on Dr. Brown's pacifiers. There's also the Ninni pacifier, I believe it's called. This is also a really good one. And what's really awesome about the Ninni is, well, especially for feeding therapists, you can actually see what baby's tongue is doing. So I can see if they're doing that proper wave-like motion or if they're not. Okay, so this is a great pacifier. I already had some of these, so I didn't need it on my baby registry. But if I was telling somebody about baby registries and what to do, this would definitely be on my list. And they are really cute. And I love actually watching baby suckle from the other side while they're actually using the pacifier. Okay, so ideal ones are this Ninni pacifier, the Philips Avent, anything with a cylindrical type of a shape, or even a little bit cylindrical with a taper, right? So you can see, whoops. So you can see it has that cylindrical shape right up front, and it's tapered just like the breast can be as well. Okay, so hopefully this was helpful, and you can put these right on your baby registry.